Another factor is lack of exercise. And then we're going to talk about stress and its effect on dysbiosis of the oral microbiome and the dysregulation of your immune system. So let's start with nutritional. Really key things that I'd like everybody to think of. Your mouth needs saturated fatty acids and vitamin C, B vitamins, vitamin E. The production of CoQ10 is really important in the body, or supplementation with it, because that's how, the higher the metabolic need, such as your heart, your skin, and your gums, you need more coenzyme Q10. It's how we produce ATP. It's kind of the gas in the gas tank. And as we get older, our ability to produce things like CoQ10 go down. But saturated fatty acids are often overlooked for their ability to foster balancing of our microbial ecology. And they also help protect teeth with mineralization. So in looking at this, I thought was a very good study from the American College of Nutrition Journal on vitamin SFAs, saturated fatty acids, and vitamin C, helping to keep your microbiome, that rich organic garden that I was speaking of, being rich and diverse. That's what we want. We want we always want a bacterial flora. The more robust the organic garden, the healthier it is. The more monolithic, kind of like using pesticides on your lawn, to get rid of weeds and trying to have only nice little pretty blades of glass. Well, what often happens is when you use these products, the first thing to grow back are the weeds, not the pretty little blades of grass. So the diet and the oral microbiota go hand in hand. And this was looked at even prehistorically, that when we had a simpler, more diverse diet, we had a more diverse microbiome. And when we shifted to less vibrancy, richness, and diversity, we saw more oral health problems develop. So exercise also, during exercise, increases in certain microbes produce short-chain fatty acids, and they are essential in reducing inflammation. So short-chain fatty acids, a lot of research has gone into short-chain fatty acids that help to reduce the body's inflammation and the inflammation in your mouth. I was often amazed at people who were at runners, and I used to see runners having a low incidence of periodontal disease, periodontal inflammation. And I couldn't understand it until the science was emerging, showing this ability for microbes in the mouth producing short-chain fatty acids reducing the inflammation associated with gum disease. Now, just one proviso, extreme sports, extreme exercise, marathon running can actually tip the balance and go back the other way and be too stressful to the body. But healthy exercise, healthy mouth. Stress is another really interesting effect in the mouth. People under stress grind their teeth, salivary flow slows down, making them more prone to gum disease and also tooth decay. I always tell people saliva is the lifeblood of your teeth and gums. Blood is the lifeblood of your bone. And we'll talk about that later, because in necrotic bone, you really need a healthy blood supply in the skeletal area of the body. But it's really interesting when we started to look at using music and all of these, yoga, meditation, mindfulness, and stress management techniques, going to a spa and getting a massage, listening to calming music. We spoke about exercise, having a hobby or an interest in this mindfulness and what it does. And what we see is the effect of the microbiome and the brain, the effect between the bacteria in the mouth and the brain during stress, and how when we manage stress, again, we see balancing of tryptophan, a very important hormone, tryptophan metabolism, and the production of microbial metabolites, which I was speaking of, the short chain fatty acids. So yes, oral care, using healthy oral care products, good nutrition, that AAA, alkalizing, anti-inflammatory, antioxidant rich nutrition, healthy exercise, and the management of stress are 4 key ways that you can have a healthy mouth and a healthy body. Let's talk about, excuse me, let's talk about jaw osteonecrosis and what the effects of this is on your immune system and on the health of not only your mouth, but the health of your body. So for everyone, jaw cavitations, which you may have heard of now, they're becoming more and more commonly talked about. And there's 2 reasons for that. One is the technology has emerged where we can actually see these in 3D in the human jaw. So 2-dimensional x-rays make it difficult or nearly impossible to see these stealth infections in the jaw. Very often dentists don't even take panoramic x-rays, never mind a 3D cone beam. But a cavitation is an unhealed hole in the jawbone. It's caused by, very often, the most common place that these are found are in the 3rd molar areas, where you may have had your wisdom teeth removed. And they're caused by an extracted tooth, root canals as well, or an injury to the tooth. And it's a silent infection, chronic illness, and chronic inflammation in the jaw, in these holes. By the way, the word cavitation was made up in 1931 by an orthopedic surgeon who found these holes in the human jaw where there wasn't pain reported or fever or swelling. Again, a stealth infection. And he called it a cavitation because a cavity is the most colloquial term for a hole in the tooth. So a hole in the tooth is a cavity, a hole in your jaw is a cavitation. And most dentists never heard of these. These were not even discussed in dental school. The second reason why we're hearing about this a lot more is because functional medicine doctors who are looking at total body wellness are recognizing that when these are treated, when these cavitations are treated, often patients improve in their systemic health. And so these silent infections, which have been overlooked and impossible to see with past technology, are now very much in the forefront of integrative health. So this is a cavitation formed from a dental extraction site. And there's an illustration on the left of what it looks like. You could see this thin eggshell of bone with the gums on top. So often when a dentist examines you, he's not going to see beneath here without a 3D x-ray. And this is part of a 3D x-ray that is showing an outline, but 2-dimensionally, this may look like a little different shadow, but you really can't see this hollow space, which is the cavitation in the actual photograph to the right. When we open the, reflected the gum tissue back to the bone and we use a laser to get into these, you can see this hollow dead space. These are often known to harbor parasites, mold, candida, antibiotic resistant bacteria, and lots of other heavy metals and other harmful, or lots of parasites find a place because it's warm, it's dark, it's moist, and you can see there's a poor blood supply. There's no blood coming out of here. So I created this protocol about 10 years ago to treat these because prior to that time, biologic dentist, or holistic dentist rather. Biologic dentistry, I'll explain the difference later, but it's a philosophy of medicine that really originated in Germany and Switzerland, where we look at root causes of disease and we recognize the body's innate ability to self-regulate and heal because of a divine life force that each of us has. And this life force we have is often called the field in biologic medicine. And in Ayurveda, they call it prana. In Chinese medicine, they call it qi. And in Western world, we call it the spirit. But we are mind, body, spirit indeed. And so for you to heal, we in biologic medicine, we believe there are 5 levels: biologic, biochemical pathways that need to regulate and heal, energetic pathways to regulate and heal. And then psycho-emotional health is equally important. What we believe, we manifest. There is a doctor, some renowned cell biologist, written many books at this point. Dr. Bruce Lipton wrote a book called The Biology of Belief. What we believe can change our DNA. So what we set our intention on. So psycho-emotional levels are known and respected in biologic medicine, and even spiritual connections to source, to our creator, whoever you recognize that as God, is equally part of our ability and our life force, our divine life force, to give us the capacity to self-regulate and heal. Doctors don't heal you. You heal you with this capacity. When doctors assist in the elimination of interference, which is toxicity, inflammation, and the things I'm speaking about here with cavitations. So I created this protocol for the treatment of these by creating 3 very effective ways to get into the hole without causing trauma. We use a laser, which is a light. Prior to this, many holistic dentists or dentists that perform these procedures used a surgical drill, which is very traumatic. We want to disinfect and debride these areas as effective as possible. Laser is very good for that. Ozone is very good for that. And then we want to stimulate regeneration of the bone and create a matrix for that bone to heal.